I'm Dr. Mark Canales, an interventional cardiologist with Adult Cardiovascular Consultants. We know COVID-19 can attack the heart, damaging your heart muscle and causing blood clots. Don't ignore your symptoms. Given the current COVID-19 pandemic and its impact on the American public and those most at risk, which are those patients with heart disease, underlying lung disease, I represent those patients who have heart disease and what should they do during this crisis that we're having. Yes, we are seeing patients with COVID-19 in the hospital. St. Luke's Baptist Hospital is where I primarily practice out of. It does involve multiple organ systems. There's a lot more known today than there was just 60 days ago. Those patients that are highest risk, which was just recently published here in the past 4 weeks, are males, advanced age, and obesity are the three big risk factors. You actually have less risk as a female. Other coexisting comorbidities, shall we say, are diabetes, emphysema, autoimmune disease. So patients with coronary artery disease and congestive heart failure are at increased risk for having the worst outcomes with a COVID-19 illness, in the respect that if you have heart failure, you're not normally using your full lung space to exchange oxygen and carbon dioxide if you have fluid on board, meaning that the remaining lung is where the COVID-19 is going to go to occupy space, and you're going to start suffocating. Separate and in addition to that, this particular virus causes blood clots. And interestingly, not the big kind that we're familiar with that come from the legs and go to the lungs, but actually starts in the native vessels in the lungs from the outside of the lungs inward. So this is a different type of blood clotting that we have not seen previously. This blood clotting process presents two problems for us. The first, it is a consumptive process. It uses all your normal blood clotting factors and uses them up, which then increases your risk for spontaneous bleeding because there's nothing to check. Just anything, any injuries such as, shaking someone's hand, bumping into something. Obviously, you're lying in bed in the intensive care unit in the worst case scenario. So you're going to be subject to bruising just from lying down, and there's nothing to check that in this consumptive process. So it's actually a twofold problem. And we are still mapping out ways to best handle this situation. The, the most common questions that we entertain as cardiologists are, should I go see the doctor? Can I put off my care? Can I just make an appointment 6 months from now when all this is over? I'm really afraid to come in. And first, the reassurance that we take every measure in the practice to provide a safe environment for the patient to come in. We also offer telemed, telehealth, where we can telephone you if your fears are that worrisome. Also, depending on what the need for the office visit is, some of them can be handled easier just by the telemed instead of you making the trip in. But every measure is afforded for your safety to come to the practice, to including the rooms get scrubbed after each person goes in there and leaves. So you're not walking into a room where someone has just left without it having a thorough cleaning before you get in there. We all should wear masks, if not for yourself, for the safety of your neighbor. I think that message needs to be understood by all. You're not just wearing it because you were asked to wear it. You're wearing it because you're concerned about your fellow man. So wear the mask out of those concerns. Number two, it is a pandemic that we're in right now. And as we discover more and find out more about this, we are going to be forthcoming with what we recommend. There will be changes. There will be stuff that was said 3 months ago that is no longer applicable at this time. So we keep current with what we're doing. We're going to get out the information as soon as we get it. We're working feverishly behind the scenes to get a vaccine out and close this chapter.